When we look at the evolution of viruses, they will generally mutate and they would evolve into becoming more well adapted, and they will then generate advantages. And what we've seen with SARS-CoV-2 is that transmissibility is the most important advantage. When you're getting viruses that are evolving to become more infectious, they will generally become less severe. A virus that makes you very ill means that you will sit at home or in a hospital and you won't be spreading the virus around.
What is the world getting wrong about Omicron at this stage?
This particular variant, the vast majority of its mutations are mutations that are new. We don't know what they do. So it was a very high level of uncertainty. And because of the uncertainty, people panicked. But we now have more information that shows that there are particular trends emerging, and at this early stage, that there's no reason for panic. There's no reason to create travel bans. It's COVID-19. We've dealt with the past variants. We're dealing with this variant, and we're going to deal with the other variants that are still to come.
There's an increase in COVID cases among children. How does it present in children?
We saw an increase in the number of admissions in younger people, especially in the below fives. But that was a very early observation. But it looks like that increase in the larger number initially of children below 5 has now changed. Even though we had more children initially, those were largely very mild cases.
Now, there are also reports showing that there is an increase in reinfection. What does it mean about natural immunity from prior infection? What does this indicate?
The number of reinfections in our fourth wave is increasing quite dramatically. There's a 2.4-fold increase in the number of reinfections. It looks like past infection is not providing protection against Omicron variant infection. This is not unusual because we saw the same with the beta variant. The beta variant, it didn't matter whether you had a past infection or not, you were still getting infected with beta variant because it's able to break through past infection and past immunity.
Are you seeing it evade vaccines?
We are seeing cases of breakthrough infection and people who are fully vaccinated, but that's to be expected. No vaccine is 100% effective. The vaccines tend to remain highly effective against hospitalization and severe disease.
So based on South Africa's experience, what about boosters? How much does it have an impact on Omicron?
Due to global vaccine inequity, South Africa had difficulty acquiring vaccines very early this year. Most of the people vaccinated in South Africa have not reached the time point where they would require a booster dose. The medicines regulator has just approved booster doses. I'm not so sure the booster doses are going to do much for the Omicron variant, because we don't have any data. At this stage, it is a pretty good idea to give booster doses, particularly to the elderly and to the immunocompromised, because those individuals don't develop very good immunity to just 2 doses of the Pfizer vaccine. We initially gave healthcare workers a single dose of the Johnson & Johnson vaccine. Those individuals are now being offered a second dose.
Earlier, we heard that Omicron was due partly to the unvaccinated or to the low rate of vaccination. Could you clarify that for us, please?
We have some circumstantial evidence that suggests that immunocompromised individuals who develop a long-term persistent infection are able to lead to these kinds of mutations. And we've certainly seen that in cancer patients, patients with advanced HIV, and so on. So that's what we think is responsible for creating these variants. It's not strictly true to say that it's just vaccine inequity that's responsible, because in many of these individuals, 2 doses of vaccine, you still don't get a good immune response. But what there is with vaccine inequity and the low vaccine coverage is that there's a higher risk of immunocompromised individuals getting infected because of higher transmission of the virus. So vaccine inequity is indirectly associated with the creation of variants. I am of the view that in Africa and in poor countries, we get infected just like rich country people do. We have to get oxygen just like people in rich countries do. We die from this virus just like rich countries do. So we should be getting vaccines just like the way they do, because it's the right thing to do. It shouldn't be that Africa will get vaccines because we're a threat to the world. We're going to create variants if we don't have vaccines. I don't think that that's appropriate. I don't think that's correct. We should get vaccines because the coronavirus pandemic affects us just like everybody else, and we deserve the protection of vaccination just like everybody else.